Good morning, students. This is Professor Eknath Aire from Divine College of Pharmacy, Satana, Department of Pharmaceutics. So, students, here is the quote of the day. Stop saying I wish, start saying I will. And if you will start saying I will, then you will definitely get success in any your goals. Okay, with this beautiful quote, we will start our today's session. So, as you already know, we are uh, going through the chapter which is compartmental or the compartment modeling, in in which we already discussed the uh, one compartment open modeling. In that, IV bolus, IV infusion, and extracellular infusion and extracellular administration we already discussed. Okay, so uh, in this lecture we will start the new topic from this compartmental modeling, which is the multi-compartment model, which which follows IV bolus administration. Okay, so this multi-compartmental model also called as the delayed distribution models. Okay, because it having the multiple compartments. So let's start the intro part. So, as name suggests, multi-compartment, the pharmacokinetic models represents drug distribution and the elimination in the body, and a model should mimic closely the physiologic processes in the body. Okay, so one compartment model adequately describes the pharmacokinetic of many drugs and uh, instantly the distribution equilibrium is assumed in such a cases and decline in the amount of drug in the body with the time expressed by the equation with a mono exponential terms, okay, which we already discussed earlier. So however, uh, instant distribution is not truly possible for an even larger number of drugs, and drug disposition is not mono exponential but bi or the multi exponential is possible. Okay, so this is because of the body is composed of a heterogeneous group of the tissues, as we already know, and each with different degree of the blood flow and affinity for drug, and therefore different rate of equilibrium is also there. Okay, so we can say the ideally or a true pharmacokinetic model should be the one with a rate constant for each the the tissue undergoing equilibrium, so which is difficult to predict mathematically. So in the compartmental models, drug tissue concentration is assumed to be uniform within a given hypothetical compartment. Okay, so all the muscle mass and the connective tissues may be lumped into one hypothetical the tissue compartment that equilibrates and drug from the central or the plasma compartment. Okay, so multi-compartment models were developed to explain and predict plasma and the tissue concentrations for the behavior of these drugs. So you can say that the in the contrast, a one compartmental model is used when the drug appears to distribute into the tissues instantaneously and uniformly. So, multi-compartmental model are thus based on the some assumptions. So, we will discuss of that assumptions. What are they? Okay. So, we can say the first assumption is the blood or the plasma and the highly perfused organs such as brain, heart, lung, or the liver and the kidneys constitutes the central compartment, or we can say that compartment as a central compartment. Okay, then other tissues with the similar distribution characteristic are pulled together to constitutes the peripheral compartment or the tissues on the basis of the similar in their distribution characteristic, or we can say we can characterize them on the uh, their similar way of the distribution. Okay, then next assumption, we can say that the intravenously administration or administered medication are introduced directly into the central compartment too. Okay, then also we can assume that the irreversible drug elimination either by hepatic biotransformation or the renal excretion takes place only from the central compartment. So like this we can uh, get or predict the assumptions regarding these multi-compartmental models or the delayed distribution models. Okay, so let's move on the next part. So here is the central compartment, which is, we can say, these are highly perfused tissues or the blood make up the central compartment, and the multi-compartmental drugs are delivered concurrently to one or more peripheral compartments composed of groups or the tissues with lower blood or the perfusion and the different affinity for the drug. So, uh, many drugs given in a single intravenous bolus dose demonstrate a plasma level, then the time curve that does not decline as a single exponential or the first order process. And then the plasma level time curve for a drug that follows a two uh, compartmental model shows that the plasma drug concentration declines by exponentially as the sum of two first order processes or the distribution and the elimination process. So you can say that the multi-compartment characteristic of a drug are best understood by the giving it as the IV bolus and observing the manner in which the plasma concentration declines with time. So we can predict by using of this central compartment and the multi-compartment statements. Next part is two compartmental open model. So the uh, a drug that follows the uh, a drug that follows the pharmacokinetic or a two compartmental model does not equilibrate rapidly throughout the body as is assumed for a one compartmental model. Then in this model the drug distributes into two compartments, the central compartment and the tissue or the peripheral compartment. So central compartment constitutes representation the blood represents the blood, extra cellular fluids and highly perfused uh, tissues. The drug distributes rapidly and uniformly in the central compartment. And next is the second compartment, or we can say this compartment as well, uh, peripheral or the tissue compartment as well for this central or the second compartment only. And then this is known as the tissue or the peripheral compartment contains the uh, tissues in which the drug equilibrates more slowly. Okay, the drug transfer between two compartments is assumed to take place by first order processes. So from this classification, we can say that the classification of a particular tissue, for example, brain, into the central or the peripheral compartment depends upon a physicochemical property of the particular drug. Then a highly lipophilic drug can cross the blood brain barrier, and that the brain would be then included in the central compartment also. So interesting thing is there, the brain or the brain compartment is turned into the central compartment. Then in contrast, a polar drug cannot penetrate the blood brain barrier, and brain in this case will be a part of peripheral compartment despite the fact it is a highly perfused organ. Okay, so let's move toward the next slide. Here is the general grouping of the tissues or the different organs according to their blood supply. So you can see here the three columns. First one is high supply, in case blood supply, it, it may be highly perfuse or the slowly perfuse. Then the different types of tissue groups are there, or the organ groups are there, and there, or that particular organ are the tissues percent body weight. Okay, so first, blood supply is a highly perfused organ. So in that organ comes, or the tissue comes, heart, brain, hepatic portal system, kidney, and endocrine gland, skin and the muscles, as well adipose tissues or the fat and the bone marrow. And this all contains or brings the 9% body weight. Then other part, or the other uh, blood supply is related to slow perfuse. So it contains the different body tissues like bone, ligaments, tendons, cartilage, teeth, and the hair. Okay, so that particular contains particular type of the weight. The skin and muscle carries the 50% weight. Adipose tissue and marrow carries the 19% of weight, and the slowly perfused organ carries 22% body weight. So here is the distribution phase, and which is represents the initial and more rapid uh, decline of the drug from the central compartment into the tissue compartment. We can observe here the line A, which is a uh, which is showing the tissue compartment. Okay, so then the decline in the first order process and called elimination phase, or we can say the beta phase or line B, you can observe in this graph. So from this graph we can say the distribution phase is the drug elimination, and the distribution occurs in that case concurrently. Then net transfer of the drug from the central to the tissue compartment. Then fraction of drug in the tissue compartment during the distribution phase increases to the maximum. At maximum tissue concentration, rate of the drug entry into that particular tissue is equal to rate of the drug exit from that particular tissue. So drug in that particular tissue compartment equilibrium with drug in the central compartment, or the distribution equilibrium occurs. Then drug concentration in both compartment decline in the parallel and more slowly compared to the distribution phase. So here is the two compartmental model representation. So there are several possible two compartmental models. We can say example, or you can see here the model 1, model A, model B, and model C, depending upon their different type of kinetics. Okay, so we can say the compartment was one is the central compartment here, and compartment 2 is the tissue compartment is here. Then the rate constants k 1 to 2 and k 2 to 1 represent the first order rate transfer constants for the movement of the drug from the compartment 1 to the compartment 2, and from the compartment 2 to the compartment 1. You can observe in this model, or in these different models. Then here is the relationship between drug concentrations in the tissue and the plasma. You can observe in this graph the maximum tissue drug concentration may be greater or the less or the lesser than the plasma drug concentration, and the rate of drug change in and out of this of the tissues. Okay, then we can write the equation like dct upon dt is equal to k 1 to 2 kinetic into cp plasma concentration minus 2 to 1 into ct. Okay, total concentration. So next part is the relationship between the amount of drug in each compartment and the concentration of drug in that compartment is shown by the CP or the plasma concentration is equal to dp upon vp and ct is equal to dt upon vt, where dp is the amount of drug in the central compartment and dt is the amount of drug in the tissue compartment, and vp is the uh, volume of the drug in the central compartment and vt is the volume of drug in the tissue compartment. So by using a rate equation we can write this previous equation as dp uh, dcp by dt is equal to k221 into dt upon vt minus k122 into dp upon vp minus k into dp upon vp. Okay, then rearranging this above equation and we'll get the uh, dct upon dt is equal to k122 into dp upon vp minus k221 dt upon vt. Then the drug concentration in blood and the tissue, we can calculate the plasma concentration is equal to dp upon vp in bracket k221 minus a upon b2 b minus a into e minus at plus k221 minus b upon a2 b or a minus b into e minus bt. And in case of the total uh, concentration related to the tissue is equal to dp upon vt in bracket k122 upon b minus a into e minus at plus k 122 upon a minus b into e minus bt. So for the amount of drug in blood and the tissue we can say that the dp is equal to dp in bracket k221 minus a upon b minus a into e minus at plus k221 minus b upon a minus b into e minus bt. Then uh, in case of dt we can say that the dp into 1 to uh, k 1 to 2 upon b minus a into e minus at plus k 1 to 2 upon a minus b into e minus bt. After this we can say that uh, the rate constant for the transfer of the drug between compartments are referred to as micro constants or the transfer constant and relate the amount of drug being transferred per unit time from one compartment to the other. And the uh, constants a and b are hybrid first order rate constants for the distribution phase and elimination phase respectively. So from this statement we can write a plus b is equal to k122 plus k221 plus k. And after getting this equation or from this equation we will get the ab is equal to k221 into k. So here is the next equation which is cp is equal to dp upon vp in bracket k221 minus a upon b minus a into e minus at plus k221 minus b upon a minus b into e minus bt. So here are the constant a and b are the rate constant for distribution phase and the elimination phase and can be write as cp is equal to ae minus at plus b minus bt. So the constant a and b are intercept on the y-axis for each exponential segments of the curve, and we can write a is equal to d0 is equal to d0 in bracket minus a minus k 2 to 1 bracket complete upon vp in bracket a minus b. And in case of the b, we can say that the d0 in bracket k 2 to 1 minus b bracket complete upon vp in bracket a minus b bracket complete. So here we can say the c0 is the plasma drug concentration, yeah, immediately after the IV injection. So this overall process is for the calculation of your two compartmental open model for the intravenous or the IV bolus administration case. Okay, so enough for the day. Up to here, you have to revise nicely. Okay, and uh, take blank paper, and on that paper you have to revise again and again for the better understanding. Okay, so thank you so much. Remaining part we will discuss in our next session. Okay, so thank you.